Welcome everybody to this 60-minute presentation on women's health in the naturopathic practice. This is a presentation for the Alternative Medicine College of Canada, and it has two goals. The first one is to contextualize the following course modules: F445 on orthomolecular approaches and natural health products, and F343 on metabolism and nutrition. The second goal of the presentation, of course, is to bring the course material more alive by explaining the way that the theory would appear in private practice in the naturopathic setting. And today we're talking about women's health specifically because women, wives, mothers, are oftentimes the first in their family to turn to naturopathic medicine. So the women of the family will come with their health problems, and if they were treated effectively, they will recommend that their husbands and children also come in for treatment. And also, of course, because naturopathic treatments are actually extremely effective to help out with women's health problems. There are essentially two types of women's health issues, if we like to think of them in a naturopathic manner. The first are organic issues. So what I call an organic issue is when a woman presents with any kind of hormonal or gynecological symptom, and there is actually the presence of an actual lesion on a pelvic ultrasound. So if they go to their gynecologist and a pelvic ultrasound is performed, they will see the presence of either a fibroid, a polyp, an ovarian cyst, or there will be signs of endometriosis on other forms of investigative tests. The other type of women's health problem is what we call functional issues, in that there are symptoms, but when women have come or gone to their gynecologist, the pelvic ultrasound is normal. So the person may have heavy periods, painful, irregular periods, spotting between periods, and yet the pelvic ultrasound is normal. There is no actual organic lesion. Premenstrual symptoms and symptoms of menopause would fall into that category as well. And vaginal yeast infection, also known as candidiasis, of course, can present with actual organic changes that are visualized in the gynecological office, but they are still mostly considered a functional issue because it is easily and promptly reversible. Obviously, naturopathic treatment is going to be much more useful in the treatment of functional issues, but remember that functional issues, a lot of them, if they go untreated for too long, become more entrenched, harder to treat, and they can sometimes turn into organic issues. So a functional issue is already a sign that there is some sort of imbalance in the body that needs to be looked at and rectified. And if it's not, it will turn into an organic issue eventually. It is important to be able to recognize symptoms of organic issues to be able to practice naturopathic medicine safely. So if you are the first point of contact between a patient and the medical world, meaning you're the first point of care, it's important that you're able to recognize an organic issue, because sometimes the patient should not be in your office, but rather at their gynecologist or GP's office. And if you feel like the symptoms warrant it and you're worried that this is actually an organic issue, you need to make an adequate referral to their GP or gynecologist, especially if she hasn't seen one already. Oftentimes, if there is an organic affliction, like a large fibroid, a large cyst, a lot of endometriosis, the woman will have to go through conventional medical treatments, even if that involves some sort of surgery and so on, or medical treatment with medication. But you can educate your patient and tell them that after they've gone through the surgery and so on, they can come back and we can then use our more helpful naturopathic tools to prevent a recurrence of the problem. Because of course, if nothing changes in their diet and lifestyle and so on, the problem is just going to recur. And also because you want to know the nature of the issue so that you're able to make a prognosis and able to inform your patient as to whether our naturopathic treatments can indeed help, and if they can, what kind of timeline are we looking at. So obviously, if the woman is presenting with a 10 centimeter diameter fibroid, our therapies are not going to be helpful, and they probably do need to go through the fibroid surgery and then come back and see us. In addition, a lot of these organic issues really do need to be checked out because the symptoms can become very problematic and put your patient's health at risk. So it is part of our job to be able to recognize that. So we'll briefly go through the possible organic lesions and their symptoms, or at least their most common symptoms. So we'll start with fibroids because they're extremely common. They can occur in any age, but they usually go away in the menopausal years because they are fed by our estrogens and progesterones. A fibroid is essentially a benign growth of the muscular layer of the uterus. So it's not the endometrium, which is the layer that is shed during the menstrual period. It's actually the muscle layer that grows into a fibroid. They don't turn into cancer. So actually, if they're small, we usually don't do much about it. But the bigger they grow, the more problematic they become. The most common symptoms being spotting or bleeding between periods, or periods that are becoming increasingly heavy. Once they become very large, so over 5, 6, or 7 centimeters, they can actually start becoming visible like a pregnancy, or they may press on the bladder and create urinary frequency or urgency. These are lesions that can be visualized on the pelvic ultrasound, and if you recognize some of these symptoms, you want to make sure that your patient has had an ultrasound so we can assess the size of the fibroid. If it's small, we may be able to get rid of it with our herbs. I would say anything below 2 centimeters we can get rid of. Anything larger than that, and only surgery will be able to get rid of it, or entering menopause. So definitely you want to refer to a gynecologist if the person hasn't been investigated. Polyps are also, generally, they are benign tumors, but they're in the endometrial layer, and they can be either in the uterus or on the cervix, which is the opening of the uterus. They can become cancerous, although it is generally rare, and it takes many, many years for most people. Again, we're looking at symptoms that are similar to those of fibroids, with a lot of bleeding between periods, sometimes bleeding after intercourse if the polyp is located on the cervix, periods that become heavier, and sometimes it can create lower abdominal pains. So again, if the patient already knows about the presence of polyps and wants to undertake treatment, that's okay. But if you suspect that it's there and it hasn't been looked at, you want to refer to a gynecologist. Endometriosis, this is something that happens in the endometrial layer of the uterus, and where basically we have endometrial tissue that is growing outside of the uterus. So this endometrial tissue is exquisitely responsive to the estrogens and progesterone fluctuations in our menstrual cycle. So it will grow under the influence of estrogen, and then it will be maintained and grow further with progesterone. And then normally during our periods, when both of these hormonal levels go down, we shed our endometrium, and that is what the period is. So what happens in endometriosis is if we have endometrial tissue that grows elsewhere, usually in the pelvic cavity, so it can be on the ovaries, on the fallopian tubes, but it can also be on the intestines, and sometimes it can even be found elsewhere completely in the body. It is something that we cannot visualize on an ultrasound. We have some blood tests that indicate that maybe there is endometriosis, but actually the only really good way of knowing is through investigative laparoscopy, so actually taking a look inside with a camera. It's important to identify because when there's been many years of endometriosis, there will be a lot of scar tissue present in the pelvic cavity, which can be visualized through the laparoscopy. And this scarring will prevent proper implantation of the embryo, and that makes endometriosis an important cause of female infertility. Most of them will have symptoms, but a good quarter of them do not. So a lot of women feel like everything is fine, and then they try to conceive and start the journey of understanding why they're not conceiving, and it may well be endometriosis. This is something that if you have a suspicion of, you really want them to go see a gynecologist, because if they have endometriosis and they're trying to conceive, the conventional treatment is to have the surgery where they basically, with a laser, get rid of the endometrial tissue that is not located where it should be, and then they will put women on certain types of hormonal inhibitors to prevent its regrowth during the time of conception. So there's a window about 6 months before the endometriosis comes back where it's easier for a potential embryo to implant itself. So you don't want to waste time with this, especially if you're working with a woman who's trying to conceive. So the most common symptoms are painful periods. Usually they're exquisitely painful. Sometimes they're so painful that it creates nausea and vomiting. There can be pain during intercourse. sometimes pain when going to the bathroom, or frequent random pelvic pains, and they can come with ovarian cysts that we call chocolate cysts in the case of endometriosis. So if you suspect that that's what it is, the person hasn't seen a gynecologist, you need to refer. Ovarian cysts are, again, growths that can occur on the ovaries, and you can see them on a pelvic ultrasound. If they're small, again, they may not be problematic. They might only be creating more menstrual cramping. But if they're larger than a few centimeters and they can really grow to be the size of a mango, they can rupture, and that is a medical emergency. And it's extremely painful. Ovarian cysts can be either functional, which means that it's really just your ovary trying to ovulate, and occasionally there's a little cyst that forms. They are usually the kind that will go away from one menstrual cycle to the other, and they're usually solitary and not really a concern. They can also be due to endometriosis, in which case we call them chocolate cysts, and again, they are usually solitary. But if you have multiple small cysts on both ovaries, that can be due to polycystic ovarian syndrome, which we'll talk about later. But again, if they have these types of symptoms or a history of them, you want to refer to a gynecologist. If the person has organic lesions, it doesn't mean that you can't work with them. What we're saying is that we want her to have seen a gynecologist, and she needs to have a proper diagnosis, needs to be established, and you want to know that the person is stable, so that we can safely work in the naturopathic context with them. So then we can start treating them. Remember, it's also a question of legality. If there's any problem down the road, you want to make sure that you've done your due diligence, and you've done the safe options before starting to treat with our modalities. Now we'll move on to the functional issues that can affect women. So again, these are those where there is really no organic lesion that is present. I've listed them here, and we'll be talking about them in a minute. We'll start with heavy periods. So to ask the proper questions and to do a proper intake around women's health, you really need to know how to ask questions about the period, because that is usually a topic where women have not been extensively either asked about or educated, so they may not be very forthcoming with the right information. So you need to know what to ask. Women, if you ask them, is your period heavy? Some of them won't really know what to answer until you go into the specifics. So, of course, how many days does the period last? A normal period is anywhere from 3 to 7 days. Anything longer than 7 days is what we might consider heavy menses. You can ask them how often they change their tampon and pad. Anything more than every couple of hours is considered too much. And if they need to wake up at night to change a pad or tampon, that definitely qualifies as a heavy menstrual period. You also need to ask about the consistency of the flow. Clots can be normal if they're small. We usually talk about clots in terms of coin size. So I don't know where that comes from, but you can ask the woman what is the size of the clots in general, and anything that is larger than a $1 coin is problematic and is usually associated with fibroids or endometriosis. So you definitely want to ask, because they're little clues that there might be something organic going on. This may also be a good time to do just a little bit of education about menstrual products. Again, because this is a topic that is remaining a little bit taboo, that women have usually not really been educated about. They may not know that we have actually a larger choice of menstrual products than we've had in the past, and that it's very useful to try and help the environment. So this is just a little statistic. For the 40 years of menstruation of a single woman on the planet in her lifetime, she will use about 9,600 menstrual products. So if you multiply that by the 3.5 billion of menstruating women on Earth, that's a lot of menstrual products. Most of them are bleached and contain dioxin, and they are not properly recycled. So they either end up in a garbage dump somewhere, and their chlorine and dioxin leaches and contaminates the groundwater, or they are burnt, and then we have poisonous gases essentially that are released in the environment. So it's always good to, if you have a good relationship with them, and you may not do this on the first visit, but just make sure that they know about, First of all, that we now have pads and tampons from organic brands, which are not bleached, they're not using dioxin and so on. Also remember, you don't necessarily want to have these toxic products in contact with your vaginal mucosa for every period over a lifetime, essentially. We also now have menstrual underwear. This brand Thinks is relatively recent, and it's essentially underwear with an integrated gel inside, so that women can wash them and reuse them for the next period. So obviously that means a lot less disposal, and it's therefore more planet friendly. There is also recently a brand called Dame that has made an applicator for tampons, which I've put here on the top left, which is made out of silicone and allows you to insert a regular tampon, but without always having to use a disposable applicator, which is a significant source of plastic pollution. So even if you're disposing of conventional tampons, at least you're reusing your applicator. And finally, of course, there's the menstrual cup that has been around for about 15 years, but it's gaining in popularity. So we used to only have the Keeper made out of latex and the Diva cup made out of medical grade silicone. But now, as you can see, we have lots and lots of brands of various different shapes to fit, different body types. And they're very good because they're very durable. One woman can reuse her menstrual cup from a period of 5 to 10 years. They are washable, and don't create extra plastic pollution. So if your patient doesn't know about them and you have a good relationship with them, you can have a little conversation about that and contribute to helping our environment. So if your patient comes in and they're complaining of heavy periods, the most serious thing to worry about, of course, is the risk of anemia. So blood loss can lead to anemia. The main symptoms of anemia will be feeling tired, especially with exercise, and some women will develop frequent infections. Some of them will also look a little bit pale. If you suspect anemia, you need to order certain blood tests, like a complete blood count to look at their hemoglobin and red blood cell count. You want to measure their serum iron, total iron binding capacity and percent saturation, and of course their ferritin. So some women will have normal serum iron, but their ferritin will be low. So ferritin below 40 can mean that your patient will feel fatigued. So sometimes you have to raise ferritin for them to feel better. So this is something to definitely watch out for. If the person presents with heavy periods, we actually have some very, very useful medicinal plants. These are the three most popular and effective ones. We have Capsella, or shepherd's purse, which is here in the middle. You can see its little pear-shaped leaf. It looks like a shepherd's purse from the olden days. And we have yarrow, or achillea, which is the white one, the white flower here on the right-hand side. These two are very, very useful to help dry up a menstrual period. And geranium, which is the purple flower at the bottom, is also a very good digestive astringent. So it's not only useful to help with heavy periods, but also with things like ongoing diarrhea for no obvious reason. So you can use them either continuously through the menstrual cycle, so if your person has a lot of spotting, for instance, or you can use them just a few days before the period and during the first few days, so before the period or during the first few days of the period, where it tends to be heavier and more problematic, and you can dose every couple of hours if it's really bad. You can use the mother tincture as single herbs, or you can mix them together. We have a lot of products now that are in capsule form. I've put one here from Vitanica, which is a pretty well-known brand, that can sometimes also make it easier for your patient to take, but they work very, very well. Irregular periods, that is a very common problem as well, and it can be due to a great deal of causes. Generally speaking, a normal menstrual cycle lasts anywhere between 21 and 35 days. So a good menstrual cycle is not necessarily 28 or 30 days. If your patient has had regular menstrual periods every 21 days, that may be just her normal. Anything shorter than that or longer than 35 days is a concern. Again, to find out about the length of the menstrual cycle, you need to ask the right questions. First, what is the interval between their periods, of course. You want to ask also whether it's changed. Did it used to be more regular? Did it used to be longer and shorter? And of course, if it's just a one-off period, that's a little bit different. That doesn't really matter. But if periods are now consistently getting shorter or consistently getting longer, well, that's a problem. You definitely want to ask about the birth control pill. The birth control pill will provide your patient with a whole slew of hormones, and that will override their normal hormonal production. So normally, when somebody takes the birth control pill, they take it for 21 days and then they stop for 7 days. And during those 7 days, what happens is that because of the sudden absence of hormones, there will be a withdrawal bleed, meaning that the endometrial layer will be shed. And that's normal and healthy. But that also means that a period that a woman has while on the birth control pill is not really her real period. It's just a withdrawal bleed. So, of course, if she tells you her periods are regular when she's on the birth control pill, well, that's kind of expected. If her periods used to be irregular and that's why she was placed on the birth control pill and now she wants to stop, for example, because she's trying to conceive or because she has very bad side effects, you can expect her period to become irregular again if nothing really has changed. Periods can also be irregular for a few months after stopping the birth control pill and then gradually normalize. That's also quite common. A lot of women will also have their menstrual cycles affected by their stress, so you want to ask how stressed out they've been, what their diet has been like, of course, and depending on their age and what they're doing, you may suspect menopause or pregnancy or polycystic ovaries as a cause, which we'll talk about in a second. A lot of women have not been educated around signs of ovulation and that their menstrual cycle is healthy. So it's a good idea to ask them if they have noticed any symptoms or signs of ovulation or other fertility signs. Now, because most women have no idea of what their fertility signs or signs of ovulation may be, it's a really good idea to educate them on that. It can help for contraception, it can help for conception, and it can help in your treatment plan because sometimes the periods haven't become super regular again, but we have signs of proper ovulation returning first. So to know about that is very useful. So this is a little simplified graph that shows us what happens with our hormones during our female menstrual cycle. You see at the bottom there, that's your endometrial wall. So you can see that it gradually becomes thicker between the end of a period and the beginning of the next one. And in the middle there, you can see what the ovary, or rather what the follicle is doing. So what happens is that during our period, estrogen and progesterone at their lowest, and it is because of their absence that the endometrial lining is not sustained and that we are actually shedding the endometrial layer. Gradually, between the end of the period and ovulation, what will happen is that estrogen levels will rise. And it is this rise in estrogen that allows the little immature egg in the ovary to gradually mature. At some point, there's so much estrogen around that we have a peak of the hormone called LH, or luteinizing hormone, and that will allow the ripe follicle or the ripe egg to rupture out of the ovary. And this is what we call ovulation. Now, in this first half of the cycle, because of the rising estrogen levels, what starts happening as well is that our cervix starts producing a fluid that is supposed to help should there be a sperm around. And so as you approach ovulation, there will be a vaginal discharge that is increasingly prolific, increasingly transparent, increasingly wet and lubrifying, and basically at ovulation it will have the texture of egg white. And this is very nourishing for the sperm should it come in the woman's pelvic cavity so that it can swim all the way up to the egg. So that's the point. Once the egg has come out of the ovary, it will survive for 24 hours. If it's not fertilized, it will then turn into the corpus luteum. So there is only really 24 hours where the egg is around. The corpus luteum is what starts producing progesterone, which is this green line at the bottom. So in the second half of the menstrual cycle, we have gradual increasing levels of progesterone. Finally, in the 5 to 7 days before the period, the liver starts breaking down estrogen and progesterone so they no longer nourish the endometrium. And when they're low enough, we will have a period. Okay? So in order to know if a woman is ovulating, you can ask her, has she experienced that classical egg white vaginal discharge, and is it regular around the same time every month? And of course, the other thing is their body temperature. So when they wake up and they measure their temperature and graph them, we now have apps to do this, like the app Kindara, which is very well known. When the corpus luteum is around and starts producing progesterone, so roughly 24 hours after ovulation, we will experience a rise in temperature of about 0.5 degrees Celsius. So if this rise is observed between the first half of the cycle and the second half of the cycle, it is a sure sign that ovulation has occurred. And why this is important is because in order to have regular menstrual periods, you need to have proper ovulation on time. So this is what you're asking your client. Has she experienced any signs of fertility or ovulation? So the cervical discharge, what happens as well is that as soon as the egg has turned into the corpus luteum, whereas before there was prolific, transparent, slippery discharge, it suddenly dries up and there's no more discharge for the second half of the cycle. Some women experience a sort of pelvic pain during ovulation, which we call Mittelschmerz. And what happens also is that the cervix will start changing consistency. So in that first half of the cycle, with increasing levels of estrogen, the cervix opens up, softens, and moves upwards in the pelvic cavity. And then right after the formation of the corpus luteum, the cervix closes up, becomes very firm, and it moves back down closer to the vaginal opening. So if a woman is not too squeamish and is used to inserting tampons and so on, you can teach her about what the cervix is doing, and that is another very reliable sign of whether she's ovulating. That can be precious information for women trying to conceive or people who are looking to do natural forms of contraception. But for you, it's also a great way of knowing how hormonally healthy the person is becoming with your treatment plan. Basically, the length of your menstrual cycle helps to tell you how you should be treating this person. So if periods are generally late, meaning the menstrual cycle is longer than 35 days in general, or if it's longer than 40, 50, 60 days, then quite likely your person is not ovulating. There's basically not enough estrogen produced in the first half of the cycle, so the egg can never really fully mature, and so you're just not getting a period. Or if you are, it's when the endometrium has become eventually so thick that it just gets shed, but it's not due to proper ovulation. Or if your cycle is closer to, say, 40, 45 days, maybe you're just not producing estrogen in large enough quantities, so ovulation occurs late, like maybe on day 25, and therefore your period is late. So late periods usually mean you need to work on getting the person to ovulate and therefore on estrogen. It's not that simple, but it's a crude picture. Now, if periods are generally early, it means that what we call a short luteal phase, meaning the person has ovulated, but there's not enough progesterone produced by the corpus luteum to maintain the endometrium. So after a few days of that, the period starts happening. Of course, you're looking for signs of ovulation for both to know if ovulation is taking place. We'll start with talking about long menstrual cycles, which generally mean a lack of ovulation or late ovulation. Why this would happen? Several different reasons. Very common is just a stressed out period. That's usually pretty obvious from the intake. Or if the person has been on oral contraceptives, so the birth control pill for some time and they stop, it takes a little while, sometimes 3, 4, 5 months for the body to learn to ovulate properly again. We can help with that. It can be a sign of perimenopause, which we'll talk about later, so the woman is about to go into menopause, or polycystic ovarian syndrome, which is sadly increasingly common. So we'll talk about those separately now, these causes of long menstrual cycles. We'll start with PCOS, or polycystic ovarian syndrome. Here there's a little diagram, so you see the ovary, and at the bottom there's a little zoom in on the ovary. You see a normal ovary, and next to it there's a polycystic ovary. In the normal ovary, as you recall, we have all of the immature follicles that we will have in our lifetime. As estrogen is produced, and hopefully adequately in the first half of the menstrual cycle, the follicle is able to mature. and so it will gradually ripen. And as it does that, at some point, it's ripe enough to be ovulated. What happens in polycystic ovary essentially is that we never get to a place where there's enough estrogen. So a lot of follicles are trying to mature at the same time, and actually none of them becomes ripe enough to be ovulated. As a result, we have a lot of partially mature follicles that stay stuck at the surface of the ovary, and this is what we then call ovarian cysts that are visualized on an ultrasound. So in polycystic ovarian syndrome, one of the key features is to have multiple small cysts on one or most likely both ovaries. Okay, so this is one feature. But actually, polycystic ovarian syndrome is more than just about estrogen. There is a whole hormonal cascade at its roots, and it actually has a lot to do with genetics and diet. So PCOS is actually a problem with sugar and insulin. So women who get PCOS are usually those that have type 2 diabetes and heart disease in their family history. And PCOS is just an early female manifestation of being unable to properly regulate blood sugar levels, oftentimes due to a diet that is inadequate. So, absolutely, the first and most important part of the treatment plan in PCOS is to educate your client about their diets. And essentially, if the person has PCOS, it means they have too much starch and too much sugar in their diet. The starch is anything like rice, pasta, bread, anything that is made from a cereal. And sugars are not just unhealthy sugars like Mars bars, chocolates, and cookies, but you will have a lot of health conscious clients coming in consuming a lot of natural sugars like a lot of honey, a lot of dates, a lot of energy balls, a lot of dark chocolate. And although these items are definitely a little bit healthier than a Twix or a Mars bar, they unfortunately also create a peak or a rise in blood sugar levels. And for this person's body type, it's just inadequate. So the high blood sugar levels create high levels of insulin. Oh, sorry about the typo there, there's an N at the end. High levels of insulin. And the thing is that when there's a lot of insulin in the bloodstream, there's a lot of androgens or male hormones that are produced locally around the ovary. And because these are male hormones, they really prevent estrogen from doing its job, and we therefore have a lack of ovulation or lack of maturing of the follicles, which we call anovulation, and a whole slew of other symptoms which we now know to be typical of polycystic ovarian syndrome. So those are, besides the ovarian cysts, there will have another bunch of symptoms. Not every woman will have all of those, but most will tick a couple of these boxes. And that just shows you their tendency to go towards full-blown PCOS and allow you to treat accordingly. Because of the presence of a lot of male hormones like different forms of testosterone, women will usually have adult acne, and they will have unwanted hair growth in body parts where they don't want to have excessive hair. And they can also have hair loss like a kind of male pattern baldness. Again, that's because of the male hormones. Obviously, because ovulation is not optimal or not happening at all, their menstrual cycles will tend to be very long, and they will have weight gain. That's because the insulin is essentially converting starches and sugars in the diet into body fat, which leads to weight gain. And that just further entrenches the hormonal imbalance at the root of PCOS. If you suspect PCOS, there are a few blood test results that can be very, very useful. If it's a bad case of PCOS, free testosterone levels may be high, but actually you may have women that have perfectly normal blood tests, but they do have the polycystic ovaries, and they have a lot of the symptoms of it. So in that case, you just treat like PCOS. It just means that it's not that bad yet, that blood test results will become abnormal, and that's actually an ideal place to start naturopathic treatment. Fasting insulin may or may not be high. If it's above 5, that is usually in a person who's already quite overweight or who already has really quite bad symptoms of PCOS. Fasting glucose is usually not high, but it may become high if it's been a while. So high means anything above 100 milligrams per deciliter. And on the blood test taken on day 2 or 3 of their menstrual cycle, there will be an LH to FSH ratio that is 3 or 4, meaning there's a lot more LH than FSH, a lot more than there should be, because the body just keeps on trying to ovulate. So as your treatment plan is working over a few months, you should see a normalization of these blood tests if you start with abnormal numbers. But remember, some women have very normal blood tests but have all the other symptoms. So do treat them similarly. So how do you treat them? Well, the first thing is diet. So you really need to teach them to reduce their dietary starches and sugars for at least 3 months, if not more. That can be very challenging for people to give up their rice, bread, pasta, noodles. And some people, they'll just never manage, and you just have to keep on repeating the same thing. You can have them use a glucometer for a couple of weeks to see if there's any peaks in blood sugar levels after their meals and so on. And if it peaks above 100 milligrams per deciliter about an hour after meals, or even when they wake up, then you know that there are a lot of dietary adjustments to be made. So this is by far the most important part of the treatment plan. We then have a few agents that I've listed here: myoinositol, D-chiroinositol, and N-acetylcysteine. They have been actually very well researched. And we know that inositol, which is a form of vitamin B, both myo and D-chiro, are necessary to increase ovarian insulin sensitivity. So remember, PCOS, in a way, just like type 2 diabetes, is a form of insulin resistance. So anything that will improve ovarian insulin sensitivity will help the ovary go through ovulation. So these are two very useful supplements. And N-acetylcysteine is basically a sulfur donor, and so it helps a number of detox mechanisms, and it also seems to be very useful for ovulation to occur in the ovary. We also use it now more and more for endometriosis. These are very safe supplements. The main side effect is sometimes from N-acetylcysteine, people can feel a little bit bloated, but otherwise they're extremely well tolerated, so you can really use them. Now, we'll move on to another possible cause of irregular periods, and particularly long menstrual cycles, and that is essentially symptoms of menopause. So a lot of women, again, are really not very well versed or educated around how menopause will occur. A lot of women think their period just stops one day, the same way it just came one day, but it's actually not how it happens. Going into menopause is a gradual process that can take several years. So a woman can have irregular cycles and symptoms of menopause for 1, 2, 3, or 4 years before their periods stop entirely, and that's perfectly normal. So we've learned that actually in more traditional societies, there's basically no symptoms of perimenopause. Women just gradually stop having their periods, but they feel fine. So it's very much something of the developed world, something that we're doing, and we're gradually learning that it's actually our fast-paced lifestyle that is causing a lot of adrenal fatigue. So when the woman goes into menopause, their adrenals are already tired. When we become menopausal, what happens is that our adrenals suddenly become the principal source of estrogen and progesterone production in the body. So if the adrenals are already depleted when you go into menopause, it will be very hard for the person to go through menopause without symptoms. So the symptoms will be, of course, the irregular cycles. They can also be short cycles or alternate a long and a short cycle. That's normal. It's because ovulation is now kind of erratic. Hot flashes are extremely common. Anxiety, people don't sleep well, they feel hot at night, they have hot flashes, or they start getting anxious at night. Vaginal dryness, which makes intercourse unpleasant. Dry skin are common. Sometimes it comes with poor libido. Memory is not great because they're sleep deprived. And once a person has been in menopause for a long time, because of the lack of estrogen, there's no estrogen to maintain bone mass, so they can gradually lose bone mass and go into osteoporosis. So that is why in your menopausal clients, it's a good primary care suggestion that occasionally, like once every 3 to 5 years, they get a bone density test or the DEXA scan. And if you have a client who happens to go through premature ovarian failure, which is essentially going through menopause before the age of 40, definitely they're at risk of osteoporosis because that means that earlier on in life, they won't have estrogen to maintain their bone mass. So something to think about. So menopausal symptoms essentially occur because there is a sudden drop in estrogen levels in the body. So again, in an ideal world, we'd all go into menopause with very strong adrenals so that the drop in estrogen would not be as radical, because as the ovaries would gradually go into hibernation, our adrenals would just pick up the slack, so to speak. The problem is that in our urbanized world, most women have adrenal depletion, so you definitely need to support the adrenals. The better herbs to do this, there's a bunch of them, but the ones that I like, because they also tackle a little bit of the anxiety and have somewhat of a soothing effect, are rhodiola and ashwagandha withania. Something else that helps with sleep quality and supporting the adrenals is magnesium, either a glycinate or a citrate. They're just better absorbed. And for sleep, we like to use L-theanine, which is a green tea calming extract, or valerian. Watch out, valerian can create what we call paradoxical symptoms. So the person will actually have poorer sleep quality on valerian. That only occurs in about 10% of people, but it can happen. So if that happens, just switch them to another calming bedtime herb. And then, of course, we want to use our phytoestrogens. So phytoestrogens are essentially plants, seeds, or foods that have molecules that look like estrogen. So what happens is, if the person is still having their periods, so let's say a normal menstruating woman, if you give them phytoestrogens, it really won't do a whole lot because our estrogen receptors are already saturated with very potent endogenous estrogens. But now a woman who is starting to go into menopause, she has less estrogen. So those weak phytoestrogens will come and bind the estrogen receptor on the cell, and therefore reduce the symptoms. The most famous plant for that is Simicifuga or Actea. And the extract, there's been a few studies on that, is around 40 milligrams a day in a supplement form. That usually works very well. And you can also add other phytoestrogenic foods like at least 400 milligrams of organic soy milk every day and 2 tablespoons of ground flax seeds every day. Ground flax seeds contain lignans, which are now quite well known for their phytoestrogenic effect. And make sure your soy milk is organic so that you're not giving them genetically modified foods. This protocol usually works very well to ameliorate their symptoms until their menstrual periods stop completely. And then generally a lot of the symptoms will get better, like the hot flashes, anxiety, and problems with sleep. Although, of course, the vaginal dryness, dry skin, that may persist into menopause. Vaginal dryness is something that really bothers women. It's not great for intercourse. It's painful. It puts them more at risk of vaginitis. And so what you can suggest for them is sea buckthorn. I've put the plant here. 1,000 milligrams a day for 1 to 3 months is actually very, very lubricating to that area, and also for dryness in the eyes, which sometimes occurs in menopause as well. What also works is castor oil applied directly in the eye at bedtime. It's very, very sticky, so you don't want to apply it in the daytime because it will blur their vision. But applied at nighttime is very lubricating to the eye, and it works very well. So this is definitely something to suggest to your menopausal women complaining of vaginal dryness. Sea buckthorn we now call the omega-7, so something really good to know about. Now, if irregular periods are not due to PCOS or menopause, they're oftentimes just due to stress or post-oral contraceptive. So what to do? The protocol is essentially the same, except obviously the one due to stress. You want to do proper questioning around stress and suggest strategies for them to manage stress better. But then in terms of our naturopathic agents, the number one thing to use is Vitex or chaste-tree berry, which has been used for a very long time in traditional Western herbalism to normalize menstrual periods. It's very, very safe. You do need to use it for about 3 months. I like to use the capsule form, just 2 caps in the morning. So I use that, and then on top of that, you can use what we call biphasic protocols. If you feel like the person has been on the birth control pill for really long, or they're trying to conceive so they want to get their periods faster and so on, you could also use all of these things concomitantly. So this is how to use it. in the first half of the cycle, day 1 to 15. So when we want to build up estrogens, you use phytoestrogens like Simicifuga, Dongquai, which is the Chinese angelica, or alfalfa. It's good to use a mother tincture that mixes equal parts of all of these. And then in the second half of the cycle, so day 15 to the period, you want to use phytoestrogens to replicate what the body should be doing. And our main ones are the Vitex and wild yam. We have seeds that have similar phytoestrogenic and phytoprogesterogenic effect. So again, day 1 to 15, you want to use about 2 tablespoons a day of a mixture of ground pumpkin seeds and flax seeds, which are rich in omega-3, and certain types of lignans that are phytoestrogenic. And then in the second half of the menstrual cycle, you want to use sunflower and sesame seeds, again about 2 tablespoons a day. So this tends to be quite helpful if your regular periods are just due to stress or post-birth control pill. I've put a few pictures of these plants because sometimes, we talk about them all the time, but we forget what they look like. So these are all of the little plants that we've talked about. Look how pretty they are, especially that chase tree here at the bottom, purple, beautiful. Now, there's a range of women's problems that we say are more due to toxicity rather than anything else, and that's essentially premenstrual syndrome, painful periods, and vaginal candidiasis. So these three are really just due to digestion and liver overload. So remember, in your digestive system, we have a lot of bacteria. Depending on our diet, we may be feeding the wrong bacteria. And remember that we have the large portal vein connecting our small intestine, what's absorbed in our small intestine, to our liver and its detox abilities. So if your diet isn't great, if you've got the wrong bacterial profile in the gut, your liver is going to be overloaded. Remember, your liver also needs to detox your estrogen and your progesterone. It needs to break them down. So if liver is a little bit sluggish and doesn't do that breakdown very well, some toxins will make it to the pelvic cavity to be detoxed through our period, and that's what will cause painful periods or premenstrual syndrome, because we basically still have too much estrogen and progesterone around before the period comes, and that creates a lot of symptoms. And regarding vaginal candidiasis, when we are feeding the wrong kinds of bacteria in your small intestine, there is usually a fungal overgrowth as well, which is oftentimes candida. And these candida organisms have the ability to translocate from the intestines to the vaginal cavity and start creating a yeast infection. So PMS, painful periods, yeast infections basically have a similar baseline treatment plan, and then we just modify it a little bit. So here again are the causes of digestion and liver overload. Too much starch and sugar, definitely a huge contributing factor. These just really feed fungal and bacterial organisms in the gut. Sometimes people have really bad bouts of stomach flu, and that just wipes out all the good organisms, and what grows back after that is bad organisms that produce toxins, and that overloads the liver and our digestive detox ability. Food intolerances, of course, right? It's not well digested, feeds bacteria instead, leads to toxicity. Exposure to pollutants, pesticides, dental fillings, hormonal residues in our meat, all of that is really not great for our gut health. And of course, stress. When we're stressed, we produce less stomach acid, we produce fewer digestive enzymes, so our food isn't well digested. So who digests instead is bacteria in our guts, and the wrong kind tends to multiply. So it's actually very easy to go into a situation of digestive and liver overload. How do you know a person has premenstrual syndrome? Basically, 3 to 10 days before their periods, they'll experience mood swings, either irritability, teariness, frustration, depression sometimes, breast pain, which can be range from just a bit of tenderness to extremely painful to the point that a woman can't wear a bra 10 days before her period, or nothing can brush against her breast. That's definitely a sign of toxicity. If they feel really, really bloated before their period, like visibly distended abdomen, or just very puffy everywhere, especially in the legs, like they'll tell you they put a couple of kilograms between when they're the week before their period and their period, that's definitely a sign that there's inflammation, probably due to toxicity. Headaches 3 to 10 days before their periods, again, very common, and extreme fatigue. This is super, super common. Again, most women won't come with everything, but if they come with a few of these, it's a really good idea to start cleaning up their diets. Vaginal candidiasis, basically, again, it can range from just a little bit of vaginal itchiness to a vaginal kind of burning sensation and redness. But if it gets bad, there's a cottage cheese-like discharge. So here's a picture of oral thrush, which is candidiasis in the mouth, but vaginally looks exactly the same. There are these patches of white colonies of candida, and when they are large enough and they fall off, it creates a white irritated patch on the mucous membrane, a red patch, sorry. And the problem is that when they go to their gynecologist, it's treated with vaginal suppositories of antifungals or sometimes with an oral antifungal like diflucan. But if there is a gut reservoir of lots of candida organisms, it'll just keep on coming back. And it's usually women who have had a lot of antifungal treatments and finally realize that it doesn't really resolve the matter that will end up in your office. And we can treat this very efficiently, although it can be quite stubborn. So how do you resolve that digestive and liver overload? What is common to treating PMS, painful periods, and yeast infections is this part, which what works very well is to do 3 weeks of an elimination diet. So it's hypoallergenic, no gluten, no dairy, no eggs, no soy, no caffeine, no sugar, no alcohol. So you're essentially starving bacterial and fungal organisms, and you're preventing your patient from eating foods that can be irritants to the mucous membrane of the gut. Then you're going to support digestion with digestive enzymes, a lot of probiotics, fiber. I like to use psyllium, flax seeds, or chia seeds, and lots of fluids or herbal teas. So you do that for 3 weeks, and at the same time you support the liver. So you can use a lot of our liver supportive herbs like dandelion, black radish, milk thistle. That just helps the liver detox faster and better, and it allows your patient to experience fewer detox side effects from feeling tired. B vitamins in general are useful for the detox pathways in the liver, and if you think you have a very toxic client, like they have dental fillings, for example, or their PMS symptoms are very significant, or the thrush has been there for a really long time, you can use liposomal glutathione or its precursor N-acetylcysteine. That will really clean up the liver very nicely. So you need to do that for a minimum of 3 weeks, and then you would expect the menstrual period after that, or even the one after that, to be a lot better, both in terms of premenstrual syndrome and pain. If the issue is a yeast infection, sometimes it's a little bit more stubborn. So if the person presents with vaginal candidiasis, you really need to emphasize that on top of the elimination diet that they need to do for 3 weeks, after that they probably need to do a good 3 or 4 weeks of an absolutely sugar-free diet and super low starch diet. You need to counsel them on that so that they have enough calories in their diet still, that they're not essentially starving themselves. And then you can add a few supplements that are antifungal, like caprylic acid, garlic, or berberine. They're my favorite ones. They work very well. You usually need to rotate them. So I would do like 10 days of each. And if the yeast infection still keeps on coming back, I would just repeat that rotation. Some people also like to use oil of oregano. That works too. And there are a few local treatments that are useful. So to give them faster relief, and if they're not squeamish about their vaginal area, you can recommend that they insert 1 capsule of oral probiotics vaginally at bedtime. And they need to wear a pad because obviously when they wake up in the morning and they stand up, there will be a little bit of the capsule residue that will come out. So I would use that for a week. Or if it's a bad case of thrush, you can do the garlic clove. It's very cost effective, super easy. The woman just needs to take a peeled garlic clove and she can make a few indents in it with a knife and then thread a needle through it and put a piece of floss or simply tie the floss around the clove and insert the clove just like a tampon vaginally overnight. You can warn the patient that once the garlic clove is inserted, many women get a taste of garlic almost instantly in their mouth. That's perfectly normal. Actually, the allicin in the garlic is traveling throughout the gut, and it's a great anti-parasite, and it helps to clean up the gut at the same time, even though it's a vaginal application, which is interesting. So they can do the garlic clove overnight for about a week, followed by a week of vaginal probiotics. But if they only do the local treatment, most of the time it's not enough. The crux of the treatment plan is the dietary bit, the elimination diet, avoiding starches and sugars, supporting liver and digestion. And you're using these local treatments. I realize I've written oral treatments, but they're local treatments, like the probiotics and the garlic clove, on top of the dietary bits. So that these work very, very well. In PMS, you're going to be doing the elimination diet and supporting the liver. You can add a little bit more vitamin B6 and evening primrose oil. So this is a picture of the evening primrose. That just really helps the body detox some of these sex hormones further to avoid the negative effects of those before the period. So in this presentation, we've discussed women's health problems. Remember, if you think you have an organic lesion and it hasn't been investigated, do refer to a gynecologist. And remember that for a lot of these issues, just like a lot of our other conditions that we treat naturopathically, diet really is the cornerstone. So in PCOS, in PMS, in yeast infections, women's health problems are usually a reflection of their diet and their detoxability. So it's not all about herbs and vaginal treatments and so on. A lot of it has to do with diet and the right supplementation to support hormonal balance. So remember your medicinal plants. They're very, very useful for female problems. But don't forget that some of those are actually a toxicity problem that needs to be treated with a bit of a liver and digestive cleanse. So I hope this was interesting, and we're coming to the end of our presentation. So wishing you all a very good rest of the day.